I'm Ross, I'm 71 years old and I want to become a professional golfer in the time that's left.
My name's Bert, I'm 72 and my aim is to maintain my fitness for the rest of my life.
My name is Albert, I'm 73 years of age. My recovery goal is to remain healthy and lead a happy life.
I had a doctor who was fairly proactive, GP, and he'd been monitoring my PSA and it took a little jump. So he organised to get a second opinion and sent me to a urologist who did a DRE and then suggested a biopsy. Then it was organised to go for a biopsy. Had that, came back, was given the result by an oncologist, urologist there, and it was positive. And you go into a bit of shock. You don't sort of hear what's going on. So after she'd told me the news, a specialist prostate cancer nurse came in and spent about half an hour talking to me about the implications, the possibilities, whatever. And then she suggested that I might like to talk to the resident psychologist there. So I took up that opportunity and he came in and spoke to him. And he suggested I might like to go to a men's support group based there and just hear stories from other people before I made my final decision.
The most important part was the PSA value that was measured. This was referred to by the general practitioner, and once it had doubled up in a year, the reading, that really started the whole thing off. He then referred me to a urologist.
I was picked up with just a normal checkup, 2-year checkup, PSA test, and that was in August 2012. From there you move into a biopsy situation just to see where the cancer is, whether it's spread or not. The biopsy was carried out in early July 2012. The result of that was the cancer appeared to be totally through the prostate. And from there I went for x-rays to actually define was it still in the prostate, had it moved into the bones, etc. And at that stage you're pretty frightened with that initial diagnosis, the shock of it. It hits you quite hard. Time sort of stands still at that point in your life. You realise that suddenly you may die. He spent quite considerable time talking with us, and the treatment that he recommended, depending upon the results of the x-rays and the scans, and the fact that it wasn't a disease or a cancer that kills you quickly. You have quite a good lifespan ahead of you, and he was talking 10 to 15 years, which really eased the tension at that moment. But I'm not sure that I took everything in at that time. You're in slow motion. But from that point on, once I'd left, I started to research very, very heavily onto the internet, picked up a very useful site in Adelaide, the Lions Club in Adelaide, South Australia, and picked up information, any booklet I could get, contacted PCA, Prostate Cancer Australia, and so on, and then looked through the different treatments, surgery, radiation, etc.
Yeah, it was a bit of a shock. My wife was there at the same time when we were told about the fact that I had cancer in the prostate. The doctor had suggested that surgery may be the best option and that he could do the surgery and would be available in the next 2 weeks. But on further questioning, he also said that this is not something you have to rush into. So I thought, and he told me that I could have 3 to 6 months to actually consider this. And as we were going away, I really wanted to have that extra time anyway.
You need to take in as much information as you can about the disease itself, prostate cancer, and you need to take in as much information as you can about the various treatments, and then you need to take in the information as to what the side effects of each of those treatments are, and weigh all of those up in making your decision.
The nurse gave me an information pack to take away with me, and in that had some brochures and booklets on treatments. I then went back and spoke with my GP and had a meeting, and he discussed various options. And he said, but when the crunch comes, it's your decision. So then I went away and got on Dr. Google and researched everything, whatever I could, on prostate cancer and treatments, and made up a spreadsheet of treatments, pros and cons. And from that, and then my wife and I sat down together and looked at the pros and cons of treatments and decided from there what treatment we'd like to go and do. In the meantime, I went to a men's support group and listened to various men talking about their experiences with prostate cancer and the treatments they had. And that also was invaluable in that sense. It reinforced that it's not a death sentence and you can survive it.
I guess because I have a scientific background, I sort of had a research approach to it, and I decided to really research what my options were. I started to research it mainly through the internet, but I also consulted the Cancer Council, and they had some volunteers which were prepared to talk to people who were diagnosed, who had been through the treatment, and I spoke to a couple of those with their various treatments that they had. And from there, I formed the conclusion of the route I took.
It was primarily discussed with the surgeon. He asked for a second appointment, and my wife and I went down to that appointment. He pulled out the model they usually do of the human body and showing you where things were. He went through what would be done for surgery, what the recovery time would be, what I would expect after it, explaining very clearly the incontinence that I would have after the surgery. It varies person to person. I had, I think, a rather bad experience, and he also discussed the sexual dysfunction that would come from the surgery as well. And upon that, I'd also looked at radiation, and I questioned him, could I go to radiation? And he didn't feel it was the way to go. So I decided to put my faith in the surgeon and the medical profession and have removal.
I didn't go for another professional opinion after speaking to the surgeon urologist, because we felt very relaxed and happy and contented with what he presented. I went back to my GP and told him this is what we were going to do, and he said, that's fine, that's your decision. I'll be here if you need any assistance or help afterwards.
Apart from the first urologist that I saw, I decided that I would get more advice and second opinions, and I ended up seeing two other urologists. The first urologist had suggested a robotic surgery process, so I approached another urologist who did open surgery, and then finally I consulted a third urologist who I was told would be approachable to going through the brachytherapy way. And the brachytherapy I decided was best by the research I did on the internet. Once you've been diagnosed and a recommendation is made by the urologist, usually it'll be a urologist who will do the biopsy, and that's the final thing that will determine whether there's cancer there or not. It's really important to research it and research it online, consult everyone you can. The prostate cancer support groups are very good, and unfortunately I didn't actually speak to them before I went through the treatment.
We had private health cover, so we went for his recommendation. And he clearly discussed and gave us the gap cost, and there was also cost for the anaesthetist, of which they gave us a quotation prior to surgery. So at the time that I entered hospital, I had basically all of the knowledge that I needed to be prepared for what would come.
I decided to have the robotic prostatectomy. So I had pads on for about 10 days, and then I was able to go without pads. So I was fortunate. I haven't suffered from incontinence, which is good. Sexually, it's taken a while to get back to any form of reasonable enjoyment. It's now 2.5 years since the operation, and I'm now sexually active with my wife. I tried all different things to improve that. For the incontinence, I'd started doing exercises 3 months before the operation to strengthen my pelvic floor, and I still do them today.
I had the brachytherapy, which consists of going in hospital overnight, and they conducted 2 lots of doses, and then immediately after that, I think it was the next week, I started the beam radiation, which was a series of radiation exposure for only a matter of 10 minutes a day, and but it was over about 7 weeks, 5 days a week. In the conclusion of that, I was still on the hormone treatment, which continued for 2 years, and that was, you know, the sum of all the treatment that I had.
The treatment that I opted was for surgery. The worst side effect is definitely at that stage incontinence. Lack of control of bladder is for me, was an absolute enemy, and it caused a lot of stress at different times. You'd feel you would get through it, and then all of a sudden you'd have a setback again. But eventually, with talking again with a surgeon, at one stage, I remember one Sunday I got very desperate and I rang Incontinence Council and spoke with a male nurse there who gave me some support. That was helpful, but I was at that particular time, I think week 4, week 6, thinking that this wouldn't be going on, and it was. And it became a real personal battle. But eventually it changed. And when it changes in steps. It's not a slow, you improve suddenly and you sit stagnant for a while and you improve again. So it does, when it starts to improve, it's encouraging, you feel a lot better in yourself. It's a lot better.
During nearly all of my appointments with the specialists, I was accompanied by my wife, and it was very good because she picked up a lot of things that I missed, and reminded me of them. And, you know, this was really good because I would get a certain impression and then she'd say, no, you know, the doctor said this, he didn't say that, and I'd realise, so that was very important. As well as that, I kept a record of all the appointments and reports that I had, and it's now into a second lever arch file, so it's building up. And I thought that was pretty important because it showed progress and what things had happened over that time, which even now I forget a lot, and it's only when I refer back to it I realise some of these things. So.
All I wanted to know was when could I start my normal activities. So I asked, when can I play golf? When can I swim? So week 3 he said to me, you're cleared, you can now play golf and swim. I was into it. When can I start riding the bike again? He said 6 weeks, but I don't think you'll be able to do it. 6 weeks he cleared me to ride the bike. He was right, I couldn't do it, I couldn't sit on the saddle. So by week 9 I was sitting on the saddle and riding. But other than that, I just had a positive look to get back to normal life.
Look, out of the blue, about 9 or 10 months after the operation, I started getting anxious about things and going out. So I contacted the prostate cancer specific nurse at the hospital where I had the operation, and she talked to me and said, look, it's not uncommon, it happens quite often with people, especially the men, after maybe 9 to 12 months you have a bit of a reaction. She said, if you'd like, I can arrange for you to come and speak to the psychologist here. So I accepted that and I went in. So she suggested that I write a diary of my experiences to get it all out. So I sat down at home after that and just thought back to when I was diagnosed and started writing and writing and writing, and I found it very cathartic. That sort of released a lot of stuff that I didn't know I had inside, just reliving it.
I wish I'd had more information, and that's really on all those side effects that you get. Particularly quality of life and your sexual functions. I probably could have researched that a lot more beforehand, but it wouldn't have made any difference to the final outcome anyway, but at least I would have known earlier, that's all. And I think there's a lot more that can be done there to help men to get through that pretty difficult patch, I think.
I attended the prostate support group at Heidelberg Group, and I would strongly recommend to anybody, either particularly prior to surgery if you can, and after surgery, attend a prostate support group. I've attended the Night at the G's, which is support nights for prostate survivors, and I feel that that's a must. That's a must. You're on your own, and I know men that have just basically withdrawn, and that's not going to help you. You've got to come out and talk to people.
I would say exercise certainly really helped, both being reasonably fit beforehand, but definitely afterwards as well. Just maintaining, and seems to have been quite an approach now to encourage people who have suffered from cancer to go into routine exercise.
First of all, it's not a death sentence. There are treatments, and there are very successful treatments available for prostate cancer, and there are tremendous support systems available for you. And I'd say use everything you can in terms of information, support, decision making, and it's not a journey by yourself. Include your partner, include your immediate family, because if something happens to you, they're all going to get affected. So yeah, be very inclusive.